Hi there, let's talk about the common carotid artery as well as the internal carotid artery. So, firstly, the common carotid artery. The left one arises directly from the aortic arch, and the right one from the subclavian artery. It will ascend along the trachea and then bifurcate within the carotid triangle into the internal and the external. We'll also talk about the internal carotid artery in this presentation. And near the bifurcation, which in a lot of sources is at the level of C4, but can vary in people, being even C3, C4, C5, C6. It just depends on the particular body you have a look at. But C4 is a good starting point to remember. So near this bifurcation of the common carotid artery, wherein it splits into the internal and the external carotids, we have the carotid sinus, as you can see in the picture, which is basically a dilation, which means an enlargement of the internal carotid, and the baroreceptor of the carotid sinus is innervated by the glossopharyngeal nerve, which is good to remember. And as you can see, the carotid body, it is an oval structure and it is behind the bifurcation, so it's located posterior to the bifurcation, and it is innervated also by the glossopharyngeal nerve. Something important about the carotid body is that it takes information of chemical composition to the respiratory center. So it sends information actively to the respiration center. So that's good to know. And then we will have a look at the parts of the internal carotid artery. So some sources will tell you there's parts C1 to C4, but it's always good to know the parts C1 to C7 because a lot of good sources will tell you all of these parts. And let's go over them briefly. There's C1, the cervical part. You have C2, the petrous part. C3, the lacerum part. C4, the cavernous part. C5, the clinoid part. C6, the ophthalmic part, and C7, the communicating part. Each of these parts will give off different branches that we will have a look at, of arteries, of course. But parts C1, which is the cervical part, C3, which is the lacerum part, and C5, the clinoid part, do not give off any branches. So do remember that. And let's talk about the branches. So you have a good mnemonic called a VIP scoma to remember the branches. And do remember that the parts C1, C3, and C5 gave no branches. So let's proceed. You have the caroticotympanic artery, which comes from the petrous part C2. The Vidian, also from the petrous part C2. So you can remember these together in a way. Then you have the meningeal and the inferior hypophyseal arteries from the cavernous segment, C4. You have the superior hypophyseal and the ophthalmic from the C6 or ophthalmic segment. And then you have the posterior communicating artery and the anterior choroidal artery from the communicating segment, C7, as well as terminal branches, which are usually grouped differently because that's how the artery usually ends up. And those are your anterior cerebral artery and the middle cerebral artery. And it's a bit more clear here as well, if you can have a look. And let's go over the circle of Willis. It's quite important to the brain because it usually acts as protection against ischemia, or tries to, because there's multiple different pathways and branchings of the arteries and not just one way that blood can reach the brain. So in an event that there's some sort of hypoxia or there's issues with the oxygen supply being met, supply demand issues, then you have the circle of Willis, which is very relevant and important. And the main source of this circle of Willis is the internal carotid artery, of course, which will then give you different branches. You have the ophthalmic, anterior communicating, anterior cerebral, middle cerebral. Then you have the posterior cerebral, and you also have the pontine arteries, the basilar, you have the vertebral arteries. So it's just important to know that the circuit of Willis is a collateral blood flow between the anterior and posterior parts of the circulation of brain, and it acts to help in events of vessel damage or diseases, etc.